Hello everyone, welcome back to CareerMudhra. My name is Dr. Pratiksha Gupta and I'm a Senior Quality and Research Expert. In today's video, we'll talk about the scope of non-clinical branches of MDS. First of all, I would like to break this myth. There's nothing known as non-clinical branches. These are some layman terms which have been founded by people over the time. There cannot be any non-clinical branch of dentistry because whatever non-clinical branch you refer to like OP, OMDR, PhD, they are all related to patients. In all these departments, you come in direct interaction with the patient, so we can never consider them as the non-clinical departments. So moving on, let's talk about the importance of non-clinical branches in dentistry and let's break the myth today. Firstly, I would like to clarify one thing. That when it comes to OP, OMDR and PhD, people are very reluctant, like these are non-clinical branches, we should not take admission in that. But with coming time, we have seen a huge demand in such courses along with a lot of job opportunities in the digital era, or we can say after the COVID crisis. Talking about the first branch that I would like to mention is oral pathology. So people are very much scared of the oral pathology because the syllabus is very vast. There are so many things to learn about, so many things to know about. And people only think it from one perspective, that they can only do biopsy, specimen, like check the specimens and open a lab, nothing more than that. But with the advancement in health industries, we can see so many job opportunities coming into the research field for oral pathologists. Along with that, after you complete your oral pathology, a lot of people are opening their own diagnostic centers, and with so many norms in the current healthcare sector, we can see that people can also practice general pathology. How oral pathology differs from general pathology is that in general pathology, there's no specific oral and maxillofacial section. But when it comes to oral pathology, you guys will be an expert of the oral lesions. And with so many odontogenic, non-odontogenic tumors, cysts, you get a wide array of clinical experiences. But let me be very clear about one thing. Whatever branches like OP, PhD, OMDR, the most important part in these departments is that what kind of college you select. Your college plays the major role. There are so many colleges in India who offers these branches, but they don't have the required patient flow. They don't have the required armamentarium. They don't even have the CBCT for the OMDR department. So when it comes to these branches, be very careful, like what is the type of the college that you are choosing for yourself. After the revised cutoff, we can see that there are so many seats vacant in these departments. But you have to be very crucial, like the college that you are looking for yourself, is it good or not? Does it have the required patient flow or not? Moving on, if I talk about the colleges, I would like to mention one more thing is that there are so many colleges who are going to offer you these branches at a very low cost, or even they can give it to you on paper. But I would not recommend you that. I would recommend that if you are really looking forward to such branches and you want to do better in the coming future, you should always go for a full-time course of 3 years and select a very premium college, because the fee structure is not very vast when it comes to such branches. In top colleges of India also, you can complete your full course in around 10 to 12 lakh rupees. So if you are looking for a perfect non-clinical branch course for yourself or the college, you can definitely contact us. Now moving forward, let's talk about the oral medicine and radiology department. Now OMDR is a very interesting department as you become an expert of the diagnosis. After completing your MDS in oral medicine and radiology, you are definitely capable of opening your own CBCT center. Nowadays, so many patients have become so educated, they know what is the importance of OPG, what is the importance of lateral ceph in their orthodontic treatment, what is the importance of implants, and yes, no implants can be done without the use of CBCT machines. In fact, in the coming future, as we can see the rise of oral cancer in India, there are so many lesions in the oral cavity which needs to be diagnosed radiographically. So it's very important that OMDR should go hand in hand with the other branch of dentistry. And one more thing, these departments are the core foundation of dentistry. Dentistry cannot perform without such departments. Apart from that, if you want to do much better in the field of oral medicine and radiology, nowadays so many OMDRs are tying up with multiple head and neck cancer oncologists for the radiation therapy of this area. Along with that, you can also do your fellowship in TMJ, in treatments like arthrocentesis, and then your TMJ rehabilitation. OMDRs also play a very important role. So do not think that these are the non-clinical branches. Such branches actually becomes the core foundation when you're setting up your own clinic. And in many colleges, you can see that in these departments, you are going to know about the general dentistry procedures also. You'll be having a proper posting in all the departments of dentistry in order for you to learn the general dentistry procedures. Let's talk about the public health dentistry. Now, public health dentistry has seen a huge demand in the coming years, with so many PHCs and CHCs setting up in different cities, 1 tier, 2 tier, 3 tier cities. We can see that government is launching so many yojanas, and public health dentists play a very important role when it comes to the job opportunity in such sector. And yes, so many job openings can be seen in the WHO also for PhDs. Apart from this, in public health dentistry, you're going to learn an array of things. You're going to be an expert of epidemiologies, biostatistics, and yes, let's not forget about the so many camps that are being organized at different levels by the government itself. So if you're thinking about public health dentistry and very reluctant that what am I going to do after this branch, it's a beautiful branch, and nowadays it's too much in demand after the COVID crisis. So many research centers being put across all over India has opened a array of opportunity when it comes to OP, PhD and OMDR. Now, talking about setting up your own clinic after doing your MDS from such branches. We have this very big myth that people who have done their MDS from these branches cannot run a proper clinic. You can see so many dentists in India who have passed out their MDS from these branches and they're running their clinic very successfully. As you know, I told you that OMDR is going to make you an expert of diagnosis, and same happens with OP also. Along with that, talking about PhD is not going to limit you from practicing general dentistry. If you pass out from any of these branches, you are well capable enough to practice general dentistry wherever you open your clinic. And definitely for more complicated cases, you can call your consultants. Moving on, before ending this video, I would like to tell you that do not forget to choose the right college for you when it comes to picking these branches. Your college plays a very important role. In order to learn more cases for OMDR and OP and to know more about the health camps and organizations in PhD, you should have that kind of patient flow in the college. If your college cannot provide you with a decent patient flow, you are never going to learn anything in oral pathology or OMDR or PhD. Along with this, I would like you to make sure that whenever you visit the campus, check the departments very carefully, that what are the HODs, what are the professors that you're going to work under, and whether the college is well equipped with all the microscopes that you require in the oral pathology lab, with the CBCT, which is very much important when it comes to OMDR, and whether the college is organizing enough health camps or not when it comes to PhD. I hope this video was helpful and informative. If you have any doubt that which is the right college for you when it comes to these branches, you can definitely contact me on the number given here. To the students who have qualified right now after the revised cutoff of NEET MDS 2024 and you're looking for any such good college which has better departments and better facilities, you can definitely contact me and I'll give you the options which are best suited for you. Apart from this, if you have any other query, you can drop down in the comment section below, and do not forget to like, share and subscribe to CareerMudhra. Thank you.